Cervera. I'm Dr. Bautista Cervera. I'm the Vice Chairperson for Louisville Metro Board of Health. Welcome everybody to the November Board of Health meeting. First, we will proceed with the approval with the minutes. The minutes for October were distributed previously. And are there from the board any corrections, any addendums, any rejections? Or do we move to approve the minutes as they state? Board? Is there any move to approval?
I move that
approve the minutes.
Second.
So the motion carries. The minutes will be approved and they will state and as they are right now. Our next, I need to clarify first. I'm the vice chair and I'm conducting this meeting today because our chairperson, Madame Heidi Margulis, is on medical leave. She is improving by the day, but she will continue to be on her medical leave, wishing and really sharing with us that she's coming back soon to lead these meetings. Our next point on our agenda is the review of 4811 River Road Variance Appeal. We have Nick Hart and Connie Mendel from Louisville Metropolitan Health and Wellness to present, and the owners representing the Courtney family, Mr. Patrick Dominic will speak after them. Nick?
Yes, so what I thought I would do was provide a brief review of the activities that have occurred and provide the recommendation to the board, and then allow Mr. Patrick Dominic to speak in representation of the Courtney family. So briefly, the Environmental Health Division received a request for a variance for 4811 River Road. This variance involved splitting a current lot that is 3+ acres into 2 separate lots, one lot measuring 1 acre, 0.64, and a second lot measuring 2.02 acres. And then to install a on-site septic system onto the lot. Now we'll provide that the current lot has an on-site septic system, 2 leach fields. That the leach fields are currently not operating properly, and the property does need to replace their on-site septic system. The original request for a variance was denied due to the 5-acre rule that is contained in our Board of Health requirements that require any on-site system the size of the lot to contain at least 5 acres. Following that denial, the appellate sent in a request for appeal and submitted additional information for that appeal to support their request. I will say our staff recommendations highlight a number of challenges with this proposal. First off, the proposal divides an already substandard lot into 2 existing or 2 additional, even more substandard lots. Like I said before, for continued occupation of the property, the septic system does need to be replaced. However, dividing it into these extremely substandard lots does increase the density of the property without a functioning system. And originally, the 5-acre rule was put in place so that we did not overcrowd property with households that would potentially result in discharge onto the surface or into surface water. The proposed aerobic system does not require a traditional large area for traditional leach field, which does reduce the overall area that they will need to install a new septic system. However, these aerobic water treatment systems are costly. They do require professionals for installation, and if not serviced and inspected on a regular basis, could discharge untreated wastewater onto the ground and surface water. For that matter, or because of those issues, the variance committee cannot approve a variance to the 5-acre rule. It would violate many of the standards that we practice throughout Jefferson County. I will say the 5-acre rule is a Jefferson County rule. Some counties have no requirement and some counties have larger requirements. For instance, Lexington, I think, requires 10 acres. That said, if the board does seek to approve the variance request, our recommendation from the review committee would be to ensure each subdivided lot has its own treatment system. So we do not have two households operating on the same system. This is looking forward to future use. Even though this is potentially going to be a family estate, we always do have to look and see what might happen to the property in the future. So if the board grants this request, the variance committee and the Division of Environmental Health would request that they require both properties to have their own individual septic system. Those septic systems be applied for and approved for permit to operate by the Kentucky Division of Water, and that the owner maintain a contract for regular inspection and service from a professional. That is the recommendation of the Division of Environmental Health and the Variance Review Committee. Now I would like to turn it over to Patrick Dominic to present the case of the appellant and the Courtney family.
Madam Chair, one point, just want to share with the board.
Yes,
We are talking about an on-site system, and the 5-acre rule applies to all properties that are not connected to municipal sewers. So again, what our excuse me, environmental division director Nick Hart spoke to, again, on individual on-site systems do not have a lifetime of service. They do have to be continually repaired and will eventually fail. The issue with these is that typically they're failing polluting groundwater, not necessarily to the surface. So it's hard to detect when they do fail. But the 5-acre rule was created by the Board of Health some decades ago to prevent further, one, to encourage residents to connect to municipal sewers, and also to prevent contamination of our groundwater and other waters.
Thank you, Connie. I appreciate that.
thank you. Mr. Miller?
Patrick, you're still
You're
on
in
mute.
mute. You're on mute.
And if you have your slideshow that you want to share, simply hit the share button down at the bottom and then choose the screen which you wish to share.
Oh, you want me to do it from my end?
Oh, I can do it from my end if you would like me to. I'm
Eh, eh.
happy to do that.
If you don't mind, let's try that.
Yes, sir. Give me 1 second and I will pull it up for you. If you want to go ahead and start talking, I'll have it up momentarily.
Thank you,
Yes.
Patrick.
Yes, good morning, members of the board. My name is Patrick Dominic. I'm with Sayback, Wilson, and Lingo. We're engineering and planning firm here in Louisville. And the owner of the property, Mr. Erskine Courtney, approached us last year with a desire to construct a second residence on the property. And there's a lot of considerations at that time that we needed to dive into. And one of the most important was the 5-acre rule and on-site septic system. So Mr. Courtney and his son are also on the call too. So they can, yeah, that's great, Nick. All right, great. Yeah, what you see here, I'll just get started here. But again, if you have any questions, if you can wait till I get through here, and with Erskine Courtney and his son, we can we can try to answer any other questions you might have. But this is the location of the property. It's 3.66 acres on River Road, bounded by River Road and, of course, the Ohio River. Next. A boundary survey was done for the property, and the gross acreage is about 3.66 acres. And the survey goes back many, many years, many decades, actually. And the property line to the top extends into the Ohio River. It's a little bit unusual, but it's not unprecedented in terms of survey protocol. That's the property that Mr. Courtney owns. Let me just explain. To the lower right-hand corner of the property is the existing residence. And there's a long driveway that is shared by the property owner to the west. There are a couple of barns, obviously the driveway, some other site improvements. And it does show the two failing septic field areas. Next. I wanted to talk about this a little bit because, like all of these variances that come to you, I'm sure there are unusual circumstances for you to consider why this should be approved. One of the interesting aspects of this property was back in 1957. The property's been in the family for a very long time, since the 40s. It's been in continuous family ownership since the 40s. In 1957, there were plans drawn up by the Olmsted design firm, nationally recognized. The Olmsted Parks here in Louisville are named after him. A very large national and local footprint. The property's in the city of Glenview, and there's a lot of Olmsted influence in the city of Olmsted with the Country River Estates. And he's actually the design firm's done multiple. We've been involved in a couple of different sites that the Olmsted firm was involved with. But actually, they were engaged in 1957 to locate a second residence on the property. And that's what you see to the left-hand side of that red box is the new proposed building site that was identified. So this goes back a long time. The family had always intended on a second home on this property. Next. I just want to go over the owner's intent. As I said, it's been in continuous ownership since the 40s, along with this 1957 plan from the Olmsted firm. Both of those predate the adoption of the 5-acre minimum lot size rule. You could do this. This could have been done routinely back in 1957, but for a lot of reasons wasn't. So again, this predates, I think the 5-acre rule came into effect in the 1980s or something like that. So the intent of the property owner right now is to create this second residence for family use. Next. With regard to the septic systems, we've highlighted here the two failing septic fields. And there was a site evaluation done in April, I believe, that indicated as such that the fields were failing and that there was no practical alternative on site, given the existing structures, the drives, the wooded areas, to install a new conventional septic field. Next. There's a lot of new technology out regarding on-site septic treatment. And one of the things we have talked with the owner about is using a non-standard, non-conventional system. This is a underground system. It's a treatment system, multi-tiered. There are 3 chambers. One provides pre-treatment, the other provides aeration, and the other provides is a clarifier prior to discharge. And it transforms domestic wastewater into clean, odorless effluent in less than 24 hours. The 3 stacks you see are the only things you would see at ground level would be a couple of surface lids onto the unit so that the owner can get in and maintain and conduct inspections. This is a really clean, more environmentally sound septic system than a conventional drain field. There are thousands of these in operation. In talking with DOW about this, there are thousands of these in operation throughout Kentucky. So we think this is a really high-end, less invasive, cleaner solution to managing on-site septic. Next. We are very mindful that it's more than just the installation, the initial installation of this unit that's important. Periodic inspections are necessary. We have a sample contract. This is with a company out of Crestwood that does these types of inspections, and they can provide quarterly inspection reports, and this would be a condition of approval that with the new system, we would have to get this inspected. And these reports, I think, are filed with DOW on a quarterly basis. I think that's one of their requirements. Next. So what I've got here is a site plan of the property. Yeah, Nick, if you could blow that up just a little bit. Oh, that's perfect. That's perfect. In the lower right-hand corner, you see the existing residence, and you see encircled the 2 treatment units that would be installed on each lot. The proposed Lot 2 residence is shown off to the left, and it would have a similar line to the treatment unit and then discharge into a rock-lined open ditch on our property. But contrast the small area required for these units with the red septic fields on one of the earlier slides. And you can see these are very small, compact units that just do an excellent job of treating effluent. Next. The acreage calculation was an issue that staff raised. And it's true, the property is 3.66 acres, but as you can see, a lot of that property extends into the Ohio River. What we tried to do in discussions with, there's really 2 aspects to the net acreage that we're proposing with these 2 lots. One is that in discussions with DOW, they really wanted to have at least 1 acre minimum for each lot. That's outside your 5-acre rule. That's a statewide policy I think they would like to see. So what we've got here is a net 1 acre from the mean high water line up for both lots. So we believe this complies with DOW's permit requirements and would allow us to go forward with them if you choose to approve this. Next. The other aspect to the 1 acre is, a lot of times when we create smaller lots, they can stick out like a sore thumb in the neighborhood and in the context with which they're located. The city of Glenview is predominantly 1 acre zoning. So, and there are a lot of 1 acre properties that have conventional septic systems on them. There's very limited sewer. So the 1 acre is important in that it would not be out of character at all with current zoning in the city of Glenview. Next. If you did decide to approve the variance, we suggested these conditions of approval to make clear that the only way this property could be developed was under the circumstances that I just laid out for you. That the Norweco Singular Green Treatment System would be used for each residential lot, and that no conventional septic system or on-site infiltration beds would be permitted. We would need to get DOW approval and permits. And lastly, we would need to enter into a maintenance agreement that provided the quarterly inspections. I think those are the three unique conditions that would help protect public health and guarantee that the representations made today would be enacted. We recognize that relief from the 5-acre rule is a rare occurrence, usually has very special circumstances. I can only recall myself, after working in Louisville 30 years, I think I only did this one previous time in 2012 for a site along Floyd's Fork where we created 2 substandard lots. In this case, the applicant's proposing an advanced treatment system that'll provide better environmental performance than conventional septic drain fields. There is no construction within a 100-year floodplain, no impact to jurisdictional wetlands. There are no private wells that would be impacted by this construction, as everything is served by Louisville water. And perhaps most importantly, we would be able to eliminate these 2 failing systems. The compact nature of our proposal simply does not require the large land area needed for conventional drain fields and the replacement areas which were fundamental to the 5-acre rule. If you were to approve the variance request today, this would not end our permitting process. There are many hoops we have to jump through. We would then proceed with approval of a minor subdivision plat with planning and design services. We would file the permits for each lot with DOW for approval of the treatment units, and file permits from MSD and the building department for final construction approval. But lastly, your approval would allow this longtime owner of the property to realize the Olmsted plan and create the additional residence as planned for family use. So with that, I respectfully request your approval of this variance request. If you have any questions, the owner is available. I'm available to try and answer.
Thank you, Mr. Dominic. The Vice Chair opens the floor for questions or comments.
Can you take down the slide? I have some comments.
Yes, Ms. Henmaker.
I'm very familiar with this land. I drove past it every day for about 40 years. It's beautiful land, and it's very appealing to have a second family residence on the land. I am concerned about a couple of things and inclined to vote against this unless there are some other compelling reasons. And the first is that there are quite a few people in Glenview and Harrods Creek that live with the 5-acre rule. And I don't think we should start a precedent for making these exceptions, because I'm sure a lot of people would like to have their land subdivided. Secondly, we know when we look at our own long-term climate projections, we know that we will have bigger and more frequent floods. And this property is probably going to flood. And third, I'm inclined to defer to the experts of our own department.
Anybody else?
Yeah, I'm pulled by Margaret's analysis of this, and I think that makes sense with one consideration, I don't feel equipped to evaluate the argument that the Norweco unit is fundamentally different and a good choice. I understand that technology evolves faster than zoning and building code do, and that often new innovations in technology, construction, building, push building code and cause certain codes to be less relevant and outdated. And I don't know whether that's the case with this. So I would appreciate some discussion from department staff about their evaluation of the Norweco unit and whether that in some fundamental way changes the nature of the discussion.
Thank you, Dr. Sipol. Connie Mendel, our interim director, shared that we have Louisville Metro Engineer Manager Mike Baller for questions. Mr. Baller, do you have any comments regarding Dr. Sipol's and Ms. Handmaker's comment?
I mean, as far as the treatment units, Mr. Dominic is right in the sense that technology has improved greatly.
Mhm.
However, on that is that they're a machine.
Mhm.
Machines can break. So
Mhm.
Is
Is it a
there
good-
any chance, sorry, is
Go
there
ahead.
any chance we know or can get access to like the failure rate of these systems? You know, like what is worst case scenario? They're right there on the river. We know that there's potential for, human waste. Like what is if we were to approve this, like what is worst case scenario? What is the failure rate of this system?
No, there's not any documentation. Those systems are permitted by the Division of Water. It would
Okay.
be through their record system because we kind of step back when we consider the property not suitable for a traditional septic system, and then it goes through Division of Water without any kind of comments from our office at that point. So typically a system breaks, a lot of times they're just replaced.
And I do want to point out quickly that the current system on the property is failing and does need to be replaced. And this is likely the system that would go in to the property for the one residence existing. The part of the bigger question of this is, would the board allow one system to service two separate lots and two separate residences? Even though
sorry.
go ahead.
Connie, the appellant revised their plan and they have agreed to install two systems for
Okay.
both of the properties.
Yeah. So it would be two substandard lots with the two systems. Okay. Thank you. Please disregard my comment.
Mr. Miller, you raise your hand.
This is unfortunately, it's a tough situation we find ourselves in. It's easy to say no because the 5-acre rule exists. And that's kind of where we are at this point. And yes, as Connie said, at least on this property, even if we deny it, they're going to end up having to put at least one treatment unit on this property because no traditional system will fit and actually go into the ground and be supported properly. So,
Patrick, did you want to address any of those questions?
Yeah, I wish I had detailed records. I kind of asked all of those questions of DOW back in June, July, and he just wasn't able to provide some of that information, exactly what you requested, some of the maintenance requirements and all of that. But they do like the systems. I know DOW thinks they're certainly a better option than septic tanks and drain fields. They view the effluent coming out as a much cleaner solution. So, but he said, he said, look, we'd have to make an open records request to get that data, and they'd be pulling staff off to look at this. And I said, no, 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 we're not going to do that. So I'm sure they have some records, but it's probably pretty hard to get. The As I said, the units do have uh, lids at the ground level for each of these units. Each unit could be individually replaced, or if the tank fails completely, there's plenty of storage in there to accommodate a replacement unit to be brought to the site and reconstructed, just as we do with septic tanks and drain fields. They get replaced all the time too. So, other than that, I don't have any hard data on it, Nick and Mike, on that. I just know that they've become more and more popular, and DOW seems to like the units.
Thank you,
I
Mr.
will
Dominic.
point out, sorry, I will point out that the application survey does show the units out above the 100-year floodplain.
There is no construction. This is an unusual piece of property that sits on a very high bluff. The house, none of that's ever been flooded. So uh, I understand the comment being right next to the Ohio River, but historically, uh, that has not been a problem.
Thank you, Mr. Dominic. Deputy Mayor, did you raise your hand?
Yes, thank you, Chair. I have a question about the maintenance agreement. Could someone remind me uh, who executes that? Who's the one that's doing those inspections? And what is the consequence for whatever reason? We all have good intentions. What's the consequence of those not happening?
Well, as I understand, the quarterly reports are maybe more of a requirement of DOW. So they do get sent to DOW. The the and there are other companies. This was just a sample contract that I included in there. Um, and you know, there's an opportunity for maintenance as well as inspections through those surface units, through the surface uh, manhole lids. Um, that's part of the protocol with these, that once they're installed, you know, the reports are sent to the owner, and I believe they're provided to DOW. And obviously, it's in the owner's best interest to keep everything well maintained too. I mean, uh, just as any septic system, there is required maintenance on all of that, as there is here too.
Deputy Mayor George, we would make that a condition of approval, and then we would request that the property owner put that on a covenant on their property, similar to say like an easement.
Okay, and then I'm sorry, just to clarify, who actually conducts the inspections?
It's
Are
a
these-
third party.
It's a third party.
It's
Okay.
a third party contract, yes.
Okay. Okay, I appreciate the conversation, and I'm obviously still open to learning. I would just say my initial inclination is also to support staff recommendation on the basis that all the things Margaret and Tony said, but happy to continue to listen.
So we are opening the floor for, we have quorum for vote. So we're asking all those in favor for the exception to the variance. This means allowing for this lot to be not compliant with the 5-acre rule. Say aye. All those against? Against? Mr. Lena, do we have everybody? We have Dr. Dwayne Compton, Edward Miller, Emerald.
Everyone
Michael.
keep their hand up for me, please, so
Please,
that I can
and-
see it on screen, please. Thank you.
Yeah, with Ms. Handmaker, Carol Haskell. Ms. Paula DeSantis, Dr. Sipple. Okay.
Yes, yes.
I'm sorry for the results for the Courtney family.
I would like to make one other comment about it. While I do think, I'm not in a position to second guess the professional staff on this, and I understand the arguments and want to support them. I do also want to encourage professional staff to do a close evaluation of the changing technology and the potential that it has for supporting these kinds of developments. So I'd love to see a deeper analysis on their part, and it may lead to changes in code going forward, even though we don't support this one.
I also think that a understanding of the precedent in requests for variances like this is important. I'd like some history on similar requests that have been made and decisions that have been made, and to see if this decision is in line with others, and if not, why this decision warrants going against past precedent.
I agree. I second what Dr. Miller has just shared. We need to know the story of what's going on regarding these appeals. I'm sorry, family Courtney. This is the decision of the Board of Health. Any comments?
Yes, I appreciate your consideration of the request. We do need to proceed with a single unit to replace the failing fields that are there. So I presume we would work with staff to do that and get the necessary approvals and permits from that. So there is going to be a unit on the property to serve the existing residents. So I presume we'll be able to work through those details with staff.
Yes, Mr. Dominic. Connie?
No, I was just agreeing. Yes, that would be the excuse me, the usual permitting process and application fee through our engineer, Mike Ballard, and his team.
Thank you very much, Mr. Dominic. Thank you, family Courtney.
Thank
Appreciate
you.
it. Okay. As I mentioned on the pre-meeting notes, Madam Chair Margulis is on medical leave, and she's coming back very soon to continue leading us into the next year. I'm saddened to share, and of course happy for Dr. Tony Sipple, after of more than 10 years of graciously sharing his knowledge, experience, wisdom, and expertise. Of course, his guidance with Louisville Metro Board of Health and the community, he has chosen to move to pursue other endeavors. The Board of Health is truly grateful for all your contribution to the public health enhancement of our community, Dr. Sipple, and we wish you the best. The Madam Chair will work with the Mayor and his administration to recommend the new board member, and Dr. Sipple will end his term at the beginning of next year. Third, there won't be any Board of Health meeting in December. If there is any need, written notes will be shared with the board members. And in case something needs to be voted, it will be handled separately according to the rules. And I think we are now going to pass to our series presentation. We will have Louisville Metro's Public Health and Wellness own Abby Rogers, Bowman, and Joe Bollinger, who will present an evaluation of the Louisville Metro government paid parental leave benefit. Just please remember you have 15 to 20 minutes, and then we will follow that with questions and answers from the board. Ms. Rogers, Mr. Bollinger.
Great, thank you so much. I'm going to go ahead and share my screen real quick, and then Joe and I will get into our presentation. All right. Thank you all. Good morning, and thank you for sharing some time in your meeting with us today to talk about some of the exciting work that we're doing in the health department related to evaluating Louisville Metro government's paid parental leave benefit. Our Center for Health Equity is excited to share with you our high-level takeaways from the forthcoming paid parental leave evaluation report. The findings and results of this study is the outcome of many, many months of hard work from both our policy team and our epidemiologists on our data team, which includes Joe Bollinger, who will be presenting with me today, Bryce Kleinstuber, and Felicia Pugh, who both completed much of the quantitative and qualitative analysis of this report. And they're on the call today this morning for any Q&A support we may need. The findings in the evaluation really illustrate how important and impactful of a tool paid leave can be for families to ensure they have proper time to bond with and care for their child during critical stages of development and adjustment as a family. While the scope of PPL, which we referred to paid parental leave as PPL in our report, the scope of its benefit only extends to employees of Louisville Metro government who are eligible, mostly due to laws that preempt a citywide policy. The results of the study can be used to encourage other employers within Louisville to create similar paid family leave measures for their workforce, expanding the health and wellness benefits to even more residents here in our city. And Joe will be going into the high-level takeaways of our methodology, findings, and recommendations. But before that, I'm going to give a little background and intro to the report. So paid parental leave here in Metro government is possible today due to an ordinance that was passed by Louisville Metro Council in April of 2021. So it's still fairly new to the organization. And before this was implemented, staff who wished to take leave for a parenting event needed to utilize unpaid FMLA or Family Medical Leave Act. Now PPL acts as a paid FMLA. This also means that any FMLA used prior to PPL during the eligibility period is still part of that limited allowable allotment. And in the ordinance, it is the definition for who is eligible includes those who have worked at least 1,250 hours over the previous year or have been employed at least 12 months with the city. It provides up to 12 weeks of paid leave for those who have had a child through birth or adoption, and then provides 2 weeks for those going through foster or kinship placements. I also wanted to talk about why the health department is interested in PPL and how it's connected to health. So this connection of paid leave to positive health outcomes has been demonstrated very strongly in the research and literature. These benefits impact the health and well-being of children, their parents, and their caregivers. We know that there are many direct health outcomes, such as more time for physical recovery from childbirth, increased likelihood of breastfeeding, and reduced risk of poor mental health outcomes, such as postpartum depression. PPL has also been shown to improve root causes of health, such as financial stability, which can reduce stress and increase economic security for families. And then for our evaluation, I wanted to go over the high-level objectives, what we were looking at, what our research questions entailed in our study. So first, we wanted to evaluate the impact of health of parents and children who did receive that benefit through their perceptions and surveys and focus groups, with which Joe will be getting into more of in the subsequent slides. Secondly, we wanted to understand what recipients' experience of the administrative process for applying and receiving that benefit was, and also just their overall knowledge, awareness, and feelings about the benefit. How was our outreach process in Louisville Metro government? And then lastly, we know that Louisville Metro government is a very large employer with many offices within the agency. And so we wanted to better understand what departmental differences we saw in the utilization rates. And now I am going to pass to Joe to get into a high-level overview of our methodology.
Thank you very much, Abby. As she said, my name is Joe Bollinger, and I'm a policy analyst at the Center for Health Equity. I was kind of the project manager for this study. I helped kind of design the research strategy and helped create a couple of the survey instruments that we use. So I'm going to give you a brief overview of kind of how we did this study and our strategy for reaching the conclusions that we reached. And then I'll get into some of the results and some of our recommendations. So essentially for this study, we took a comparative design approach. We gathered data from recipients of the paid parental leave benefit. We surveyed them to find out, like, basically, what did you do on your leave? How did it impact, what is your self-reported or what is your self-perception of the benefits of receiving the paid leave? And we compared that to a population from the general pool of Metro employees who would have been eligible for PPL if they had their become parents later on. So that was kind of our strategy for dealing with the health and wellness outcomes. And then we also wanted to look at some of these administrative or implementation questions. And for those, we asked some general questions of Metro employee population. And we got some data from Louisville Metro Human Resources. So from Louisville Metro Human Resources, we got data on the PPL applicant pool, and we used that to compare against statistics about the general Metro employee population. Again, we created a survey that we sent to PPL recipients. We got 63 responses to that survey. These were recipients who had received PPL or had been approved through PPL over about the first year of the program. So that's there's been a lot of people who received the benefit since then, but we are only reporting on basically the first year of the program. We created a different survey, which we sent out to everyone in Metro government, and we then filtered down into a comparison group for our PPL recipient population. And we followed all of this up with focus groups of PPL recipients. We believe in using a mixed methods approach whenever possible, using qualitative data to explore kind of rich descriptions of people's experience. And we did that in this case. Abby, next slide, please. All right, I'm gonna get into some of our results now. These are just some descriptive statistics about the PPL applicant pool over the first year of the program. Again, this is data that we received from Louisville Metro Human Resources. At that time, which was early September of 2021, or 2021, 281 people had applied for PPL, 230 had been approved. Oh, sorry, I misspoke. This is as of early September 2022. That's a typo. 230 had been approved. There were applicants from 26 of Metro's departments. Not surprisingly, perhaps, the bulk of these are coming from some of our largest departments. So our police, fire, and corrections accounted for 75% of our PPL applicants. For people who were denied PPL, the chart there on the table on the right explains the reasons that people were not approved. Some of them, 60% had just not been at Metro long enough to receive the benefit. Again, the the ordinance says you have to be at Metro for 1 year. 21% had not reached the minimum hours required over the previous year, which is 1,250. They may have not had a parenting event that technically qualifies under the policy. And then like a kind of a combination of either having insufficient documentation or no available leave were 10% of the denials. Abby, next slide, please. Not surprisingly, again, the age of the PPL applicants kind of matches what you would expect for people who are of standard parenting age, which means that the PPL applicant pool was a little bit younger than the Metro employee population in general. Next slide. We looked at the racial demographics of the PPL applicants. They're a little bit more likely to be white than the general Metro employee population, a little bit less likely to be Black. Not by a huge amount, but a noticeable amount. Next slide, please. They're also more likely to be male than the general Metro employee population, which may be a little bit surprising. And these are kind of patterns that we're doing some follow-up research to sort of see if we can find more drivers of these kind of unique patterns, but that is still pending. All right, now I'm going to get into the results of our surveys. Again, these are really where we're looking at the health and wellness outcomes that we can trace to PPL. I think the key thing to understand from our study is that being on parental leave is good for the health and wellness of parents and their children, whether they're the birthing parent or the partner of the birthing parent. Health and wellness outcomes are behaviors that are positive for health and wellness are more likely when people are out on leave after having become parents. And this is not a surprising result. Most people who have been parents understand that this is a challenging time after becoming a parent, and you're focused a lot on bonding with your child, making sure your child is healthy and safe, learning new parenting skills, learning how to do care and feeding, and our results bear all that out. And it's also notable that this is the case regardless of whether someone is out on leave with PPL or they're out on unpaid FMLA, that they were doing similar types of behaviors regardless of why they are off work. The key thing with PPL, though, is that it extends the length of time people are out. So it nearly doubles the average amount of leave taken by new parents from 8 to 15 weeks. So that gives them more time to pursue all these pro-health, pro-wellness behaviors to improve their mental health, to recover physically, to focus on their child, to bond with the child, all of those outcomes. In fact, we know from surveying the general population of Metro employees that 24% of the parents we surveyed who became parents in the 3 years before PPL existed, 24% of them took 1 week or less of parental leave. So that's notable finding. Next slide, Abby. Another thing that PPL does compared to the previous approach to parental leave that Metro government used is that it allows employees to preserve their paid time off. So in the pre-PPL period, if an employee was taking parental leave under the Family Medical Leave Act, in order to receive any pay during that period, because FMLA itself is unpaid, they would have to use their other source types of paid time off during their FMLA leave. So under PPL, they don't have to do that anymore. So not only do they does this encourage them to take longer leave, it allows them to use their vacation time and sick time for sort of their intended purposes. You know, in the old days before PPL, people would have to like save up their paid time off in anticipation of becoming a parent. They'd have an incentive to skip, say, medical appointments or to work while sick, etc. They no longer have those incentives. So that is also a notable finding. In the pre-PPL period, a new parent was likely to use 3 weeks more paid sick time than under PPL. And under PPL, only 29% of employees used more than a week of paid vacation time. Before PPL, 79% of new parents used more than a week of paid vacation time after becoming. Okay, next slide, please. Here we're looking at some of the overall kind of summary health outcomes reported by PPL applicants. The chart on the right shows you 3 different kind of categories of health. We have child's health, mental health, and physical health. And the question was PPL valuable for these things? And PPL recipients strongly agreed, overwhelmingly, that PPL was helpful for those, or valuable for those health outcomes. We asked also Metro employees in general if they think it was likely that their colleagues will use PPL if they become parents in the future. 71% of them agree that it was. 84% of Metro employees say that they would have used PPL if it had been available when they became parents. And 63% of Metro supervisors agree or strongly agree that PPL makes it easier to attract and retain workers for my team. So that was a kind of subpopulation of our survey, that is Metro supervisors who had had experience with a team member taking PPL. And generally speaking, they were pretty supportive of the benefit and thought it was useful for their team. All right. Now I'll get into a little bit of our recommendations going forward. We did find some evidence that awareness of PPL was not as high as we might think. So we're recommending just enhancing communications across all LMG departments to make sure that all employees are aware of the benefit and familiar with it. We also got some, although from our survey data, most people who had received PPL had a positive experience with it, with the application procedure. Some of our qualitative data suggested that a minority of people had difficult time with communication and lack of clarity. So we're just recommending that communication procedures and protocols regarding eligibility and approval are reviewed and made as clear as possible. Next slide, Abby. As we mentioned,
1 minute to finish, Mr. Bollinger.
That sounds great. This benefit is available to only full-time, well, not to employees who have worked at least 1,250 hours and at least 12 months. We recommend, if possible, extending that benefit to a larger percentage of Metro employees because these health and wellness benefits are so clear. A lot of our respondents said that these 12 weeks was the minimum that would be helpful to them, and they would even more leave would have further helped them help their health and wellness outcomes. Some of them also reported that they would appreciate more support for new parents after returning to work, including some perhaps help with childcare. And finally, we recommend continuing to track how PPL impacts Metro's employees by more further iterations of this study. Abby, last slide. And in terms of next steps, we will be publishing our full evaluation soon, and we look forward to sharing that with the Board of Health and other people in the public health world in Louisville and beyond. And we hope that this policy can serve as a model for other businesses and other organizations in Louisville, because the health and wellness benefits are clear. Thank you.
Thank you very much. Is there any comments or questions regarding the presentation? Yes, Ms. Hatmaker.
I was aware of trying to get this benefit for 12 years, and Louisville Metro went from 0 to a highly competitive program. So I think that's just fantastic. And I think it's a competitive practice to not provide benefits to short-term or part-time employees. The one thing that I don't remember and might be worth exploring the rationale is I don't think that current employees are able to donate PTO to someone that they think they won't use and could then extend parental leave benefits. So that I don't remember why that was not done. Somebody had a good reason for it, but I would look into that. Nicole, do you know?
Excuse me. No, I was just speaking with Rebecca. You know, when I worked for the state, I feel like they had that shared model where you could share sick leave, and I don't know why. So this is a really good question and good conversation to continue. And I recognize what Rebecca said to me was, that's not the full answer, because, you know, theoretically as an employer, we should be taking care of folks, not dependent on employees to donate. And I would also say, though, it was in the scenarios I was familiar with, anecdotally, it was good to have that as an option. So it is a question, and I will follow up.
Thank you. Anybody else?
My only question is, you just mentioned that, you know, obviously we know that there are benefits to having paid parental leave. As someone with a ton of kids, I have had to use it throughout my career, and been very appreciative of it and fortunate to have it. So if the program or that it were to expand, what would, like, your, I guess, personal or just from the knowledge that you've gained from doing this analysis, what would the recommendation be to you know, to like decrease the amount of time you've worked with Louisville Metro, to increase this to part-time employees, or like what would be a good recommendation for how we can kind of either support or push this benefit further?
Mr. Bollinger?
I think we would be agnostic about that, at least at this point. You know, in general, just as a general principle, this kind of leave has health and wellness benefits. And you know, we're public health people. We're not necessarily, you know, involved in budgeting and things like that for the city. So we're just talking about the public health benefits. So it would be up to others probably to decide how much and what kind of extensions to make. Whatever those would be, there would be benefits to people's health and wellness.
I think also in our data, there were some in survey and focus group responses. I think that there were some barriers, perceived barriers for folks who especially were part-time. So I think that, you know, we've shared some of our preliminary results with HR, and we're hoping to have a dialogue with them on what that might look like. But yeah, when we share the full report, you can get even deeper into that qualitative analysis of drawing out people's lived experiences on PPL.
Ms. Hatmaker?
Is the benefits eligibility for this consistent with the eligibility for other non-contributory benefits provided by Metro?
Margaret, could you repeat that, please?
So Metro has a benefit plan, and I'm wondering, or a number of benefit plans, and I'm wondering if the requirements or the application of this for part-time or new employees are consistent with what Metro does for other non-contributory plans, because this is a non-contributory plan. 100% of the cost is borne by Metro. It's not like healthcare or something where you pay. So is it consistent with other Metro HR policies?
I want to say it is, and I say that based on part of the legislative process that we went through, but I will also double check that.
If it's consistent, it's kind of hard to argue against it. If it's inconsistent, you can argue against it.
I know that it uses the same eligibility that Metro uses for Family Medical Leave Act. That's all I really investigated for this project. So, but yeah, I'm not able to shed light on your question right now.
Yeah, but that makes sense though, what you said, if it's consistent with FMLA.
And I'm sure the results of this analysis will bring better things for the whole group of people that receive this benefit. Anybody else? Okay, thank you very much, Ms. Abby Bowman Rogers, and thank you, Mr. Joe Bollinger. We will continue. And now we proceed to updates from the mayor's office. Deputy Mayor George.
Thank you, Chair. The only updates, I have 3 updates, and staff will also be able to contribute to some of this. The first one would be, we have rolled out the opioid settlement RFP for the remaining approximate $4 million in this tranche, going to support a focus on long-term recovery, youth prevention work, and focused work on housing. And so those are the buckets. And again, staff can share more about that. Mayor has also rolled out his state legislative plan. For purposes of this board, I think the piece that might be of most interest is that around gun violence. So again, as we're thinking about ways to support, that might be something to consider. And then last but not least is the reallocation of ARP dollars in light of the canceled contracts with the CEOC. We are moving forward with the approximate 16 million in subawards, but the remaining 24 will be reallocated, or is recommended, I should say, to be reallocated to parks and libraries. So that's an update from the mayor's office, and staff can certainly contribute to anything I might have missed.
Any other contribution? Thank you very much, Deputy Mayor. We will continue with the interim director, Ms. Connie Mendel.
Thank you. I did want to real quick also thank Tony Zippel for his more than 10 years of service. Thank you so much for serving this board and our community. But I didn't want to leave the meeting without that information. Everyone should have in their packet the excuse me, the November report. So always a lot of things going on within the Department of Public Health and Wellness. One I wanted to speak on is when initially we launched our period equity product. So we are providing free period products in our restrooms along with those at Metro Hall. So this is just a call to others who are able to provide these products in restrooms to allow people the ability to attend school, to work, and to this is certainly a gender equity issue. And again, please read the report, and I'll just reiterate what Deputy Mayor George mentioned as far as the opioid settlement distribution dollars. That request for proposals was released on Monday. We will share with the board more information, and hopefully you will share that with your contacts and partners. We are very excited about awarding these funds to competitive proposals in those areas that Deputy Mayor mentioned. The only other thing, as always this time of year, it's not too late to get your flu shot. Please keep yourself safe with your flu shot and updated COVID vaccinations. And thank you for all of your service to this board.
Thank you very much, Madam Director. Do we have, I don't think we have Dr. Singal for as medical director. Do we have any reports on his side, or do you know? Nothing? Okay. We go to committee chairs. Family Health Center, Dr. Irwin, do you have anything to share with us?
Yes, I have no updates today. Thank you.
Thank you very much. Ms. Eleanor Manson couldn't attend the meeting this time. And JCPS, I don't see the representatives from JCPS. Angela? Dr. Stone? No? Not either the representative from Great Louisville Medical Society?
Yes, actually, this is Dr. Hargett.
Oh, thank you, Dr. Hargett. Welcome.
Yes, thank you. I just want to update that the GLMS has brought back, which was previously we were unable to do because of the pandemic, the white coat, wear the white coat experience, in which we invite different leaders throughout the community to get a chance to participate with different physicians in their daily activities to get an overview as to what we do in healthcare in Louisville. And we had 24 participants, and we paired off with different physicians in different specialties. We had our initial meeting on October the 4th for a meet and greet, and they have now partnered off with the different physicians, and this will end on November the 8th with a dinner to discuss and look at what we've done and how the participants' experiences were. The GLMS Policy and Advocacy Committee met last night in preparation of starting to work on resolutions that we feel are important that we need to start looking at to bring to the Kentucky Medical Association and our legislators next year. We also brought back the Doctors Ball, which again was put on hold because of the pandemic. And what it is the GLMS Foundation is one of the major fundraisers, as well as an opportunity for the three hospital systems, U of L Health, Baptist, and Norton, to spotlight different physicians that they feel have made an impact in their systems and our community, as well as honor physicians in the community who made a difference. And that'll be occurring on March 2nd, 2024. And we're in the works of getting all that together. And the GLMS Foundation is also working to continue to help to support students at the U of L School of Medicine in regards to scholarships and helping to defer the cost of medical education. So just wanted to bring those points up. Thank you.
Thank you very much, Dr. Harvey. We proceed now to the community reports, the immunizations advocacy committee. Dr. Eccles.
The immunization advocacy committee, with our last meeting, we're just discussing some logistical issues about a charter and how we will communicate with the board. Overall message is still to encourage anyone you know to get their seasonal vaccinations. So that being flu shots for the next, few months, and then also anyone who has not received a final COVID booster. And we will be meeting again next Thursday. I'm sorry, the date is escaping me, but we will be meeting next Thursday at 2 p.m.
Thank you so much. And thank you, Dr. Eccles. I just listened to a report. Only 12% of the whole US population has received the updated COVID vaccine. So yes, let's invite everybody who can get the vaccine to get it as soon as possible. And for young adults, you can get both vaccines at the same time. And there was a new study recommending putting both of them on the same arm with a higher response and antibody production. But that doesn't apply to older adults. For the elderly, they discovered that they can get complications. So the recommendation for elderly is a separation of 2 weeks between one and the other. I'm sorry, but I couldn't contain myself on sharing this. Regarding healthcare coverage and outreach coalition, Ms. Ashley Shoemaker, do you have anything for us? You're on mute.
Yes, can you hear me?
Better if you can get closer.
Okay, I will try to speak up. Today is the first day of open enrollment. Open enrollment continuing through January 16th. So anyone who is not eligible for Medicaid may be eligible for payment assistance to purchase a marketplace plan. Medicaid renewals are also ongoing. If anyone has missed their Medicaid renewal, they can still submit the paperwork and have their coverage reinstated and backdated retroactively up to 90 days. So we encourage everyone with questions or who has problems with their renewal or with their application to contact a connector. And our next meeting is scheduled for December 11th at 4 o'clock.
Thank you very much. The sound improved a lot. Appreciate it. Is there any action items that we need to consider as a board? Anybody? It doesn't seem so. Our next meeting then will be scheduled for January 3rd at 8 a.m. at virtual modality. If nothing is pending, the Vice Chair moves to adjourn the meeting. Is there any motion to adjourn?
So moved.
Second.
Second. Thank you very much. This concludes our meeting for November 1st. Dr. Sipol, once more, thank you so much for your graciousness and for sharing with us and with the community and your time and your expertise. Thank you very much. Have a beautiful day. Take care. And don't remember, request your COVID tests. And if you have, from past times, you can always check the expiration date with the CDC. There's a new update. So the expiration date was extended. Make sure that yours is within that range. Thank you so much. Have a beautiful day. Bye-bye.